So I graduated from Langara 2 years ago, and I'm currently working at Burnaby Hospital, and I've been working there right when I graduated. I work on the cardiac step-down unit right next to ICU. I've also, while I was working there, I also worked on neurology, medical, and IMU floors while I was in cardiac. I chose cardiac nursing because it involves a lot of critical thinking. And my unit is kind of special because we're a high acuity unit compared to most big hospitals. And our unit requires people to be on the code blue team. So there's a code blue, we run to where that unit is in the whole hospital, and then we run code blues. So it's a small community hospital. I really like it. What type of people would like to go into cardiac? So I had clinical, when I was in Langara, I was split between spine and cardiac at VGH, and with all my clinicals I was really interested in it. And I was really good in cardiology, so I applied there. So it's a good stepping stone if you want to go work in the emergency room, high acuity and ICU, cath labs, CS, ICU, and CCU. And then anywhere you want to apply, if you feel like it's stressful, they'll be like, oh my God, you're a cardiac nurse, we'll hire you. Yeah, so a lot of managers and nurses really look up to you because of your critical thinking skills. You just think differently. So to get where you are, I took the telemetry course at BCIT. It's a 2.5-month course. You don't have to take it. There are other courses you can take that are only 2 hours. Like I can teach you how to read telemetry in like 10 minutes. That's how easy it is. But you guys are doing the NCLEX now, so I think that's in your test. When I took the CRNE, we didn't have any of that. So you're good with the NCLEX, so the BCIT course or the 2-hour or 5-hour courses, and then you can apply. I know for Vancouver Coastal Health, they can fund you within their program to do the cardiac program, whereas in Fraser Health, every year, if you apply, they can pay for your high acuity or provide you courses for cardiac nursing. So telemetry or high acuity. So yeah, we see things like AFib, CHF, people that come in, crash their cars, and then they have syncopal episodes, and we're trying to figure out what's going on with them. Electrolyte imbalances, and we get patients from other units. So say they have a knee surgery and then their heart kind of goes wacko, and they come to us and we're trying to figure it out. We get drug addicts, all ages, because it screws up their electrolyte imbalances and the chemicals. And then we send them off to tests. So small community hospitals like Burnaby Hospital, Richmond, Lionsgate, they don't do surgery on the hearts, and they don't have cath labs. So we send them out for their test, and then they come back to us, and then we maintain them. We can send them home, or if they're like, oh man, you have triple vessel disease, you gotta wait here, and then you're gonna be on a waiting list for a cabbage. What you'll also see on your unit, obviously, is a lot of code blues. So with my 2 years of working on my unit, I probably had 5 code blues for my patients. And yeah, the first one's always a little scary for everyone, but then you get better at it. And then, yeah. That's about it. Do you guys have any questions? Is there anyone interested in cardiac nursing? Yeah, cool. Because we're like a specialty, unit, we don't have, like, we only hire RNs everywhere in every cardiac unit. So for big hospitals, one side would be surgical, and then the other side would be medical. So I know surgical sides, you get only 3 patients, and the medical sides, you can get 4 to 5. So if that's what you're thinking. And I know for Langara students, I didn't know this when I was in Langara. You guys have an option of taking a specialty course at BCIT. I would recommend you taking the telemetry course. And say, for example, they're good for credits. So say, for example, you get into your nursing, you're doing cardiac, or wherever you choose to go, and you have that course, and you want to do ICU, high acuity, critical care. After that course is out of the way, and then you can continue with your other credits. So it's a good idea. Good stepping stone. Yes?
Describe your typical day. What do you do on a day-to-day?
Okay, that's a good question. So, you do your vitals, your head to toe, then you give your pills out, but then you're very, you need to analyze the pills you're giving to for blood pressure, and there's a lot of tests you need to send these patients to go to figure out if it's a heart problem or not. And you can send them within the hospital or out of the hospital, and they come back. And then you see a lot of patients that we call the revolving door, especially in heart failure patients, because they come in with heart failure. All we can do is maintain their blood pressure with the pills, and then their lungs too, and then they go home and they come back. So you see a lot of that in cardiac nursing, because there's so much you can do. So yeah, a lot of tests, things can change in a heartbeat. You can have 4 patients, and then 3 are really sick, but they're okay, and then the healthiest, most independent one can drop on the floor, and then you'll be doing CPR. So you don't know what happens in cardiac nursing. It keeps you on your feet. That's what they like about it. Yeah. Hi.
What skills would a nurse need to be successful in cardiac nursing?
Yeah, one of the obvious one is telemetry reading, because once you get into it, like once you say I finished the BCIT telemetry course, and you think you can read enough, but it's actually harder. There's some patients that come in and you look at the strip, and then they do the 12-lead strip, the bigger one. Some of our cardiology doctors can't even read it. It's very hard to, it's complicated, so they have to send it to a specialist at another clinic they fax it, and then they fax it back. So yeah, you have to be very precise on what you're reading, you're measuring and everything. What I think us cardiology nurses say about ourselves is we're every organ nurse. Because cardiology, everyone thinks it's a heart. Yes, it's the pumping system, but it involves a lot of the lungs. So I've had an RT, he's been working for many years, and he's like, oh wow, I was trusting nurses on this unit with the respiration therapy, because we deal with it all the time. So heart failure, or they go into critical condition, we know what to do. Yeah, because the heart and the lungs are closely related. Also with the kidneys, we follow lab values a lot. So that would be one of the things in a typical day of nursing. We come in early and we check the lab values. So they draw blood like crazy in all cardiac units. So you gotta pay attention to potassium, kidney function, blood. If there's a new bleed, it affects the lungs. Yeah, so you gotta, I think I can go into it, but one big skill is, I came in fresh, but you start developing critical thinking skills Because I know you're in nursing school, and then you guys are doing your end class, it's like, okay, what would you be doing in an ideal world, right? But like once you get into work, you start building your own routine or making skills, and you get tips from your coworkers and everything, senior nurses and doctors. Doctors work very close with cardiac nurses, and you build this bond with them. And you know what to call, what's necessary to call them at like 3 a.m. or not. So, yeah. I don't know, does that answer the question? Yes.
I'm not sure if you've already talked about it, I may have missed this, but what steps did you take to get into cardiology?
So have you done the specialty nursing yet? You have that?
I'm going into the level 4 at PCIT, and then that's when we take our specialty courses.
Okay, then definitely do the telemetry course, because when you apply as a fresh student and they see that, I don't think you have a problem at all.
So they do accept new grads, sorry.
Yeah, they do. Yeah. And then if you preceptor, I'd say, like my preceptorship, I knew I wanted to do cardiology nursing when I was in Langara, but I think it was very competitive, so I chose the HIV unit at St. Paul's. And then I just went to apply. But now it's, one thing I wanted to touch upon. So when I got hired at Vertebrae Cardiac Step Down, I didn't have the telemetry course, but we've changed that because the patient's demographics, I don't know about other hospitals, but I have other friends working at other hospitals. There's more sick people, so they require, I believe every cardiac unit requires you to have a telemetry course before you apply now. Like I was pretty lucky, but I didn't feel comfortable without taking the course. So I took it while I got hired, yeah. Because if you end up getting a job in the cardiac unit, you'll find that the cardiac units, most of them are right next to ICU. So anything that if they're okay, they're okay from ICU, they transfer them to the cardiac unit. Yeah. And then with cardiac issues, when things go haywire and your lungs go haywire, it's just right next door. You just shift them next door. Yeah, it's sometimes, it's exciting. Yeah, do the telemetry course. Mm-hmm.
Do you shadow shifts as well for students?
For what you do?
Do you do shadow shifts as well for students interested in the unit?
I've never had a student shadow shift. Yeah, but you can ask the manager. I highly recommend it. Yeah. And then when I was interested in ICU or emergency room, because I wanted to see, people, they're like, okay, I'm 1 or 2 years into nursing right now. I know what I want to do, and then it's either emergency or ICU, and they're completely different places. You can definitely shadow shift. And I've done shadow shift on those 2 units. But I don't see, you can definitely